everyone, I'm Jyoti Sumal. I'm a dental therapist. I work for Community Dental Services CIC in Leicestershire, and I also work in private dental practice. That means you can work in a variety of settings. That means you can work for the armed forces, the community dental services, in general dental practice, in private dental practice. So you can work in these range of settings. You can even become a teacher later on and teach dental therapy within university schools. So as a dental therapist, you'll be wondering what you do and how that varies from a dentist, how that varies from a dental hygienist. So we are similar to dental hygienists in the fact that we do, in our full scope of practice and the things that we do everything that a dental hygienist does. So we are able to undertake scales and polishes. We carry out hygiene appointments. So in those hygiene appointments, we tend to clean people's teeth, but we also give them advice, and that oral hygiene advice is so important as a preventative mechanism. If we don't give that advice early on, then we're not giving them the treatment that they need to then move forward and improve things. We also work with patients with gum disease and carrying out periodontal treatment. And then also we are able to give out local anaesthetic. As a dental therapist, we work under a prescription of a dentist. So as mentioned, then with a dental therapist, as our full scope of practice, as I mentioned, we do a variety of things. So that means treating adult patients, carrying out restorations, which means carrying out fillings. We can do all sorts of fillings, white fillings, grey fillings as you might know them. So it's a very varied day, and you can see a lot of patients in one day. So it depends on where you're working to see what variety of patients you see. You might see more anxious patients, as I do in the community dental services setting. So in the community dental services, what we find is we see anxious patients, patients with complex medical histories, patients with autism, and with those patients we work towards getting them dentally healthy, which is our most important goal. So I started off in school, and I carried out work experience in school. So I went out to a dental practice and I tried what it was like to work in a dental practice. I tried on the reception, I went into the surgery, and I saw a variety of how patients are treated and the whole patient journey through the dental practice. And that's when I realised I wanted to be a dental therapist. So it's really important to try and get that engagement, see if you can get in at a dental practice, keep trying to call them, see whether you can get in anywhere to volunteer. It's a great experience. So with myself, I went straight from school and college straight to university. So I had my GCSEs and I had my A-levels, and so it was a very new experience for me. So although I had that short work experience, it was very new and a new experience to then go into university. So with dental hygiene and therapy, you can do a range of courses. So you can do a Bachelor of Science at university. You can also carry out a diploma. So the Bachelor of Science takes 3 years. With the diploma, you can do that over approximately 2 years. So it's a variety. So it depends which is the best pathway for you. So you would look on university websites, you would look on UCAS and find that variety. So you would need to pass your GCSEs. You could previously have been a dental nurse. You can have your dental nursing qualification. It all depends on what that university would like as their entry requirements. And there are also access courses which are available. So with the course, it's really important that you show your enthusiasm, showing your communication skills. Every day you are communicating with patients, so it's so important that you have those social and communication skills. Another aspect is manual dexterity. We work with our hands a lot, so it's really, really important that you've got great manual dexterity. I myself, before going to do my university interview, I took up knitting. So anything like that, you can take up a nice little hobby, which, it could be, creative colouring and drawing, something artistic. You're even knitting or crochet, anything like that, a variety of things that might interest you, and that shows off your manual dexterity skills. So you'll be wondering where to look for these university courses. So you can look on university websites and through UCAS. So looking at the course, it will be under a range of different names. So you may find it under oral health sciences, or you might find it under dental hygiene and therapy. Previously, the courses were separate in the past, but now they are combined courses. So becoming a dental therapist, you become a dental hygienist and a dental therapist together. So that entails you working through your first year, which you may do predominantly hygiene work, learning how to become a hygienist, and then moving into the therapy skills and working on them. As a dental therapist, you are part of the jigsaw as part of the dental team. So you all piece together and you work together. So the dentist sends you through your patients, you complete the treatment for them. And by doing that, it means it takes the pressure off the dentist. That way, the dentist can do more complex treatment whilst you do the treatment that's within your scope of practice. And it really helps then the dentist to work through the complex treatments. For example, they can then carry out a root treatment later on. So you can establish the trust of a patient. So you can start off with the initial stages, acclimatize that patient, and then pass them back to the dentist ready for that most complex treatment. And I love my job, and the positives of being a dental therapist is that you have such a variety through the day. Being somebody who does all the treatment, it means that you really establish a relationship with those patients. You see them regularly, so although the dentist sees them for that recall and that checkup appointment, then you get then that time to see them for those regular appointments to get the treatment done. You build that relationship with them. And being a dental therapist, being part of the team, you get to know everybody, and it's like being part of a family with everybody. And I'm very lucky where I work that we all fit well together and we work as a team. So what do I enjoy most about being a dental therapist? I enjoy treating my patients, getting their teeth back to health and being able to give them their smile back, getting them confident about their dental treatment and working with them on their treatment journey in order to get their teeth back to health. And then with the dental team as well, I feel so well supported in my role, which is why I enjoy that as part of my role. Being part of a family, being part of a team is one of the most essential parts for me. So I really enjoy having my dental nurses to go to, having my dentist to go to for any support and discussions, and also being there for them as well, and vice versa. As a dental therapist, you see a variety of patients. So around the world, everybody has different dietary requirements, and they also have different social factors which then affect your teeth. And within the community setting, we also worked with autistic patients and patients with special needs, which means we need to tailor their advice and tailoring the treatment to work with them. So in terms of advice, with our autistic patients, due to their sensory issues, we recommend unflavoured toothpaste. And with that unflavoured toothpaste, we then give the right brushing advice. We give their carers, parents or guardians, whoever attends with them, we then give them diagrams, we show them videos, and with them, that means that they can understand how correctly to brush that patient's teeth as best they can. If you want to work in the dental industry and you want a bit of a varied week, then dental therapy might be the way forward for you. So I myself have a varied week. In the past, I've worked in 4 different jobs in 1 week, and you get that variation between different teams, and it's amazing to have that difference in settings and always have a variation each day and seeing a different patient demographic every day. Also, I'm a dental leadership fellow, which means that I get to work on a range of projects. I get to work from home, and I'm one of the first dental care professionals to do this role within the Midlands. And it's a very exciting opportunity. I get to make changes within the NHS. I get to work with other leaders within the industry and making a difference as well. So not only making a difference to my patients, but also making a difference to my colleagues from behind the scenes. So it's a very exciting role. So you can progress and look in careers of different ways, and dental therapy can lead you there.